So our sick care industry needs to just be known as GoFundMe healthcare, because that's where we're at right now. Check out this headline with me. Will you do that? The medicine is a miracle, but only if you can afford it. I want you to bold that, underline it, underscore, exclamation point, message in a bottle on a train, not Southwest. I cannot let it go. A wave of new treatments have cured devastating diseases when the costs are too much, even for the insured. Patients hunt for other ways to pay. This is an absolute damn shame. April Crawford never thought she'd be begging for help on GoFundMe, but she has run out of options. She has multiple sclerosis, and Mavenclad, the drug that could slow her decline, has a list price of $194,000 a year. You heard me right. Team, leave it up. Gosh darn it, leave it up. Woo! This is when my cussing in a different language comes in handy. Her Medicare insurance will pay for most of it, but she still has a copay of $10,000. Now I want you to juxtaposition this with what that president just said last night. Can somebody help me understand this? That we let these pharmaceutical industry literally kill people in the United States of America, and most of the medicine that they come up with is off our dime. Hello, somebody, anybody. Lord have mercy on my black soul. Advances in science and immense investments by the federal government and drug companies have completely altered prospects for people with conditions that seemed untreatable in almost every area of medicine: cancer, allergies, skin diseases, genetic afflictions, neurological disorders, obesity. For many people using private insurance, innovative medicines are dangling just out of reach. You think just out of reach, $194,000 damn dollars. I said it. Even when Medicare's 2025 cap comes into play, or the $9,100 cap that already exists for those receiving insurance under the Affordable Care Act, many will still find drugs unaffordable. Research suggests that large number of patients abandon their prescriptions when faced with a $2,000 in payment. You know what? Come on, put the next one up. Researchers for Brigham and Women's Hospital, Massachusetts, found that in the median price of a new drug was around $180,000 in 2021, up from $2,100 in 2008. Take a look at this chart. Healthcare costs in the United States have increased drastically over the past several decades. I'm sick of these people. But then we get a State of the Union last night, Jackson, that says to the world that everything is doing all right. Everything is not doing okay. And this is the direct consequence of the commodification of healthcare. The greedy big pharma and private insurers are at it again. And let us not forget Pfizer, which plans to increase the cost of the COVID vaccine to $130. It sold it to the federal government for $26 a pop. But the hell with the American people. And you got them folks jumping up and down and cheering when people are literally dying, and they can fix it. We need Medicare for all right now. Not yesterday, we need it right now. And since we're the only industrialized nation without some type of universal healthcare, let's explore the benefits from what it would do. Benefits of universal healthcare would lower overall healthcare costs, may lower administrative costs, standardizes service, prevents future social costs, guides people to make healthier choices. Doctors ain't gotta fool around and fuss and argue with insurance companies about what they patients need. Do I have a witness out there where your doctor got to argue with a non-medical person at the insurance company telling your doctor what you can't have? Only in America. Jackson, I'm a cuss. I am.
I'll come in so we can keep that from happening a little bit.
Yeah, please.
But it's the thing about there's really just no rational argument for efficiency for the way that our healthcare system works, our education system works. There's really not, because at the end of the day, most of the solutions to our biggest issues are rather simple. It's just an issue of access. Because even if we didn't, like, let's say we didn't even go like all the way with, universal health care or some type of universally paid higher education system. Let's say we just took, the lower level, like free access to an associate's degree or something like that, or maybe a public option. Just that alone would give people the ability to contribute to society much more effectively. So again, there's no rational argument to keeping things the way they are. We have to keep the insurance companies, private insurance system the way that it is, because we just need competition. There has to be competition in the marketplace. But insurance companies, that's not medical competition. That's just like, I'm still signing up for insurance. And a lot of it has to do with I'm just really busy and the process is ridiculous.
Yeah.
Print this out, send this, and pick this package and do this. And every single year I got to do it differently. That's not efficient. It's just not. So
no.
I mean, even if you just look at it from a purely economic standpoint, take everything else out. It's
not. Jackson,
it's stupid.
It is not. This is wrong. We're the only industrialized nation that does this. Let's put up this headline quickly. Study. More than 335,000 lives could have been saved during the pandemic if US had universal health care. There it is. Bolded, underline it, message in the bottle. That is it on the train. That's it. We lost more than 1 million lives and counting because of the pandemic. Oh, I sigh deeply.